police, firefighters, CrossFit, carpenters, and am I missing one?
Boxing, but we don't have anybody from that group.
All right. Yeah, so in general, the only difference in terms of making a full P&P that includes both of them, or all of them, I don't think we're going to be able to include workers' compensation type clauses within the policies and procedures for CrossFit. I don't think that really applies to that. So I don't know if maybe we could come up with a modified version of it or something like that. But I guess I'll start with what I found. So with CrossFit, there's really, like I said, no clauses about workers' compensation, because maybe if you look at the CrossFit website, there might be something on there, but I highly doubt that. I'm not sure if that was found in that group. With the police officers, in terms of their P&P, they actually mentioned something about disability and like workers' leave, which again does deal with workers' compensation. The thing I found interesting with that compared to the other ones was the fact that there is an already pre-made 90-second musculoskeletal evaluation that was found in the literature. So that was their just full MSK or musculoskeletal evaluation throughout the entire physical. That was the only test. That was the only P&P that included FMS in it, or the full FMS balance as well. There also was included the police test, so the tests, I guess, to go into training or during training that determine if you're fit enough to be a police officer. And then the difference I found between this and the other ones was return to play after injury was contingent upon a physician, and all of these FMS and the Y balance and things like that were reinforced again, but it was only suggested that they continue to improve those scores, even though they don't hinder them from not returning back to play if the scores are poor. And then with firefighters, I think this was the only P&P that included more of a mental health aspect, included the Part Q on it, which I found was interesting. It does have definitions of what a firefighter is, what workers' compensation is, like specific definitions. It did include the chain of command as well, and an easy-to-flow document or an easy-to-flow chart, which I thought could be added to our broad P&P. The disqualification condition, which I didn't think about, this was the only one that included amputation specifically, and included specific injury through amputation as one of the disqualifying conditions, which I didn't think of before. And then that was really it. And for the carpenters, I mean, what we did was we did it a little differently. So we had each extremity region, so lumbar, knee, ankle, foot, things like that. And then we divided it into procedures for each body segment. So we had a general prom for each body segment, listed disqualifying conditions and things to look out for. But that wasn't really different from the other ones. But that's all I have from what I found.
So I think overall, I just have like a general question. I don't know if you guys can answer it for me. I think I was confused because my group, especially for CrossFit, focused solely on lower extremity. And I think that it was actually tough because you couldn't include a lot of overarching policies as far as the P&P goes, because then you were moving outside of lower extremity. So there's a lot of stuff in the other ones that in like psychosocial can definitely obviously be involved with lower extremity injuries, but is that like, do you include that as a separate policy in your policy procedure manual, or do you directly put it into lower extremity injury policy? Because in my mind, if I'm building a policy procedure manual, those things are separate. Same thing with including an entire P&P document in one of them. So I think maybe we can decide as a group moving forward, do we eliminate things that are not related specifically to the lower extremity, or are we literally making an entire P&P disqualifying condition policy procedure?
I think it's lower extremity only for these groups. Because we did upper extremity focus the last time.
Yeah, but
based
do
on
you
the
agree that all the documents today were not, like, I just feel like a lot of stuff that was included in this last week's assignment was not lower extremity specific.
right. Well, yeah. So some of the groups did add excess. Yeah, I agree.
Yeah, I feel like if we were to use maybe the part Q, put it in, I guess I don't know, more, that would be more general. That would be, and you use that for upper and lower extremity. So I don't know.
I struggled with that too.
I think
because
mental health would be a separate.
If I think about if I would actually do this for an organization, I don't think that I would have a separate P&P for the lower extremity, the upper extremity, general medical conditions, psychosocial. I think it would just be one P&P
Yeah.
that disqualifies with some appendices for upper and lower. So I think for the sake of this assignment, we focus on lower, or is going to, I think, be outside of the scope of this week. But just taking a step back and thinking about what I would actually do, I think, Jamie, including more broad pathologies than just the lower extremity is a little bit more feasible if we're talking about actual clinical practice.
And then the P&P for this week for the combination we're still only including lower extremity in it.
Right. So I think that when I'm reviewing all the documents, I think that there's a lot of like literal P&P, or I mean, I'm sorry, there's like literal like physical stuff being included in it. So I think that if we want to make a general provision about the pre-participation exam, we need to make sure that it only includes disqualifying lower extremity conditions and not disqualifying general medical conditions. Because I mean, we already have done a PPE assignment, like we don't need to create an entirely new one.
Okay, yeah, that makes sense. All right.
And then also anything related to the upper extremity, we can also eliminate too.
Mm-hmm.
The things that I liked about the, let me see which one, the firefighter one was the definitions. So it was like, this is defined as this is defined as that. Defining what the patient was, defining what the injury was, defining the different groups of patients. I think that would be important, especially when we have so many diverse groups of patients. We would have to define who they are and what their injuries are, because a lower extremity injury for CrossFit might not eliminate them from activity if they can still lift and do other things. Obviously it depends on activity level, but it wouldn't necessarily, I know I'm making a generalization, but it wouldn't necessarily affect them to squat if they have like a toe injury,
Shoulder
maybe, yeah, right. So but I don't know if you guys get what I'm saying, but if we create definitions of each one, I think that's what the others were lacking, mine included, in terms of defining the group that's receiving treatment and defining what injury is. And kind of like what we did in our very first assignment a long time ago, like what is an injury, and we defined it and then kind of laid out. I think we definitely need to have that in terms of what is lower extremity injury and what is lower extremity injury that either limits activity or the person is taken out. I guess we're still utilizing that. Okay, you have, and they get taken out. So it's like the testing procedure we created before, and with the 30-day out, they come back in thing. So we would have to have those definitions as well.
I actually also had the definitions as part of that particular document that I liked. So I do think that our overarching policy should definitely include, like, because I think the definition of a short-term injury and a long-term injury can be overarching for all of our populations. So I think that I definitely agree with a definition section being a part of this week's assignment. I also liked, because I know like this has to like all look pretty, I also liked the layout of the firefighter one, simply because I think it's going to be easily like, we can easily make the other documents look like that, so that they all look consistent. So that might be something to consider as well. The other thought I had, and I know that I'm pretty sure that same document had, there was some, I think 3 of them had patient rated outcomes, which we did, my CrossFit group did as well. But a lot of them are similar. I don't know if we all had exactly the same, but I think a lot of them were similar. So I think what we can potentially discuss for this week are utilizing the same patient rated outcomes across all populations, if you guys want to consider doing that.
Yeah, I agree, and I also think we should limit or condense the amount of functional testing we're going to do. So I think a lot of people did functional testing, but I don't think it's feasible to do all of it. So maybe we could find 1 functional test per joint to do rather than multiple at each joint, because I think those can be across the board as well. And then the other thing was, I think there's some discrepancy in the policies about who is like clearing the athlete for participation. So I think, I can't remember, let me see. In the carpenter one, I believe final clearance was the employer, and then mine was firefighter, which was a team physician. So I don't know if we want to kind of clear that up with our overarching policy.
I agree, because I saw that. And I know that like for my CrossFit one, it was the athletic trainer, because in I guess the way that we approached it was that you would have to do a return to play or a functional progression for a pre-existing injury to make sure you were fit to do the things at the gym. So that you got a clearance note from the physician, but then you still had to do a return to play progression with the athletic trainer for final clearance. So that was another approach that we took, but it's difficult because CrossFit, I feel like, just doesn't fit with the other 3 populations that we have. So
I also think one thing along with that we should have is definition of disability, and how that relates. I went into a lot of reading about the ADA, Americans with Disabilities Act, and I don't know if I did skim these, so, but I don't know if anybody else included it in their policies. But one of the big things that I saw, if you have a disability, you technically can't do any screening before you offer someone a job if they have a potential disability, which you can't really screen anyone, because you can't ask them, hey, do you have a disability? And they say yes, and then you can't screen, like that's not something you ask, unless you're going to ask it in a survey, which technically that's a medical survey, which you can't do until you offer them a job, right? So the only things that you can do are interviews, and then are you able to perform these tasks? Like, so do you have a history of performing tasks, recommendation letters, stuff like that? So like, until you offer them a job, you can't say you're not allowed to work here because you can't perform these tasks. It's kind of like an athletic trainer. You have to be able to lift 50 pounds. Can you do that? Yeah. Do most athletic trainers do that on a daily basis? Probably not, right? If they decide that they can't do that, like, how are they going to get tested on it? It normally happens day 1. All right, you got to lift this cooler. And if they can't do it, then they probably find a means of doing it, or, they get some sort of help or something like, what I mean? So that was one thing that I noticed that I think we should include, especially if we're going to have all of these groups together, is a disabilities policy stating that before we do any or like questioning about disability or ability or anything, they technically have to be offered a job before we would be discriminating against them. Because that came up with my group, like, okay, so are these candidates for a position? Do they already have the job? And then I answered that question by doing that research on the ADA. So we can I don't, as I said, I'm not sure about the other groups, because I was kind of like trying to look through them and find specific points, but we can kind of take what I wrote about the ADA, and I basically took from the actual ADA document an excerpt that just defines everything, because I didn't feel like paraphrasing and citing. So we can either keep that, we can change it, we can perfect it, depending on what you guys want to do, but I know we should probably include that.
Yeah, I don't know if you saw anything, but I will look if there is a like discrimination clause for voluntary gym memberships as well. So I will look into how that relates to my population, so I can include that in our overarching one.
I really liked in the CrossFit one the acclimatization period too, if an injury does occur, I think within 12 months or whatever it was, just because it gives the opportunity to rehab rather than just saying you can't sit with us. So if we have some sort of overarching, you will have the opportunity to rehab with us policy or statement, I think that would be it too.
I also think that's a good thing, because the way he talked about our little instructional video or video for this week is like trying to invite people to do it. So like even if you have something that we would put you on, I think there was some policy that I liked. It was like provisional clearance or something like that. So if you have something that limits you for a certain amount of time, you're still like involved in the organization. So we'll still offer you these services if there obviously is a potential in the future for you to be cleared for full participation or job. So I think that's a good point, and I think it's something we include in our video as like far as we are welcoming even if you have limitations right now.
The other question that I kind of had, and I guess we can answer this ourselves or we can ask Dr. Games, but when we created these policies, most of us created them as the employers, right? So we were the employers, we made the policy for our group, people that we work with, maybe the CrossFit group. I'm not sure if you guys, were you like the athletic trainers employed underneath, or was it like the people who own the gym? Was that your intention?
We were an external medical organization offering like outreach services is kind of how we approached it.
So I know that my group, we were like, oh, well, we're going to hire police officers, and this is the policy for hiring and doing that. So we weren't even thinking of being medical professionals when we were doing this. It was kind of like, okay, this is like rules and regulations and such. So it was not really tailored to the concept. So I guess we have to definitely tailor our policy and procedures manual for the group as a whole for our website. So it would have to be like, this is for our company providing care to all of these people's policy, not necessarily this is the, you know what I mean? Like policy for this place that these people work. It's kind of like, this is our policy for providing care for these individuals and doing their screening and saying whether or not they can work or not, which is weird because unless we work for the people that these people work for, it doesn't really work. I'm saying work a lot, but you know what I mean? Like who does elite prevention work for? And is the policy with elite prevention, or is the policy with these individual groups, and then they come to us with our policy? And who owns the policy? If it's going on our website.
I think we just approach it like we're elite prevention and we have affiliates. So we have like an agreement with all of these other organizations. So like similar, trying to think of an example, but like Union Health has Terre Haute South, you know, so we could do like an overarching, we're the organization, and then we have contractual agreements with all of these other different places.
Gotcha. Okay, that makes sense.
Okay, so for our, like what we're creating, like I'm trying to like imagine this. So we're gonna have a few things that are overarching to everybody, which in my mind means that we take them out of the individual documents. Is that agreed upon? Okay, so we're gonna have like definitions, and we're gonna have an acclimatization, general insurance policy is what I was thinking we would put like So for some people, it might be personal insurance. For some people, it might be workers' comp. So I think you have an insurance policy in the overarching one. And then who's doing final clearance, I think we definitely do determine same for everybody. So anyways, we're going to have all these overarching themes. So whatever they overlap, we take them out of the individual, and then we post that somewhere. So it's all of these overarching themes. So we post that somewhere in the website. And then I'm thinking, then you reference like Appendix A are CrossFit specific policies and procedures, because I think that obviously everybody's like functional progressions, like to get you back into work or to test if you're ready for CrossFit is going to be entirely different than testing if you're ready for carpentry. So that is what I imagined. So I think a lot of the what's going to be on individual patient populations is just going to be progressions and functional testing or things like that. Anybody else have any thoughts? That's what I'm imagining.
Yeah, that sounds good. And then I think the proms would go in the overarching as well.
And then we would decide, I guess we can decide now which prompts we want to use for which area. And we obviously, I mean, it depends. Like we could say that the lunge part, the FMS covers knee, ankle, and hip, because it technically does, but it also doesn't. So we need to pick something, I guess. You know, we don't want to only have one, but we also don't want to have ones that overlap too much and then we have too many.
I think maybe we could just go back through and look to see if there was any overlapping proms for each joint, because I think like 3 people did the KOOS for the knee and 2 people did the foot and ankle ability measure for the ankle. So I think if there's at least 2 that are the same, we could just use that one and just do one for every joint.
I'm also looking at the firefighter one right now, and they already have, because I know my group, I think we talked about it and never ended up looking into actually setting benchmarks for like a pass-fail for proms, but the firefighters did, so I would be down with just using those. So I don't know if that was just like you guys created that or if that was from literature, but I think they sound good, because that was part of what was missing from the proms in my policy procedure.
Yeah, there is no evidence base to that at all, but we did have conversations to see what we thought was reasonable, so I'm fine with using that if you guys are.
Yeah, I think that's okay.
And then if we just want to format all of them the same, all we did was insert one of the common themes in Word.
Do you guys mind recapping a little bit what you guys went over, because I'm trying to connect again. I missed everything.
Where did we leave off?
I don't know. I don't know.
Well, what were we talking about when you were on last?
I don't remember.
So I think what we imagined for our final document for this week was some overarching themes that we would create into its own document. So we have, let's see, proms are going to be in the overarching one. Definitions of like short-term, long-term injury, who our athletes are going to be. You don't need to write all this down. We can put it in a Google Doc. So like, don't panic.
I know.
I have it written down already.
Yeah, perfect.
Yeah, and then insurance and who has the final clearance. So we're going to have overarching themes, which means we're going to take all of those policies out of the individual documents so that they're not overlapping. So we're going to kind of take out all the overarching things. So then and then we're going to have like appendix for each individual population, which would be posted somewhere else in the website with specific like functional progressions for them, is I think what we have been talking about.
Okay, perfect. Sorry, guys.
I think my next question is, so we're doing proms for over all the populations. Do we want screening in the PPE to be the same for all populations? Because I think everybody has different functional tests. So do we want to keep them different for specific populations? or not.
What if we, yeah, why don't we just do one, let's say FMS for all of them. We might just keep it a little more simple. And then keep the, I guess, functional tests specific to each, or I guess keep one functional test for the PPE, but then I guess add maybe 1 or 2 tests that are specific to each population in addition to that functional test. So you have FMS, let's say, and then you add 2 functional tests specific to the population. For carpenters, I forget what we put, but something like that maybe.
I think if we're doing that, though, we should just keep it as is, because I think that's what everybody already did.
All right, makes sense.
Yeah, because I think I had a hard time understanding how we would do it over everybody, because like, what does the FMS really tell you? Like, it doesn't disqualify you from anything. It doesn't say that you're incapable of participating. So, I mean, if we wanted to make a policy where if you had a certain score, then we'd put you on a rehabilitation program, that's fine. But like, with CrossFit, all of our functional progressions and our functional test was obviously triple hop. Like, it's all about strength and power for them. So like, and then obviously a carpenter doesn't really need that power as much, you know. So I think I have a hard time imagining how to make an overarching PPE test besides like obviously the 90-second musculoskeletal screen. But I mean, that was part of NATA's thing anyways.
Yeah, the biggest thing with the, if we go back to our goal and the assignment and such, was to develop a policy for somebody if they had an injury and it was like found during the PPE, what do we do? Take them out. So it's like, okay, if they are complaining of an injury and they perform this functional test, whatever it is, and can't do it because of the injury, that's why we take them out. Not necessarily like this is the score they get, or this is what they, like if they can't perform a task that is related to their job, that's saying you are putting yourself at risk, you are putting others at risk, we need to take you out and fix you. So however we can do that with the populations with a like screening tool, the best way we can, I think is the goal there. Not necessarily like, okay, you're fine, and then we find out that you have issues. I think, Jamie, you are on the right track of, yeah, that's more due to rehab, something else. But if they come in with a pre-existing condition, injury, and then we have to say, well, you're not okay, right? Which we can't discriminate them for having the injury in the first place, so we offer them the job, right? ADA. But now we're trying to say, all right, well, this is what's wrong. We're going to fix you so you can work because we like you, because we gave you a job. Tool that, but I don't know which one would be good for all lower extremity injuries. So maybe we do use the FMS, but we don't need all of it. Maybe just the lower extremity parts, and then some other screening tool or multiple from the other groups, from all the groups that individualize participation for that group, and maybe just one.
Well, do you think that we need, in this case, I don't even think we need the general screening tool. I think we just use the specifics from each population. The general screening tool could be more for rehab purposes, not disqualification. I feel like the specifics would be for each specific population, their disqualification, while the general one would not. So do you think we even need a general blanket screening tool, or just use the individual tests for each?
Yeah, I say we could definitely get rid of the general thing and just use the individual tests, unless are super similar. Because what we could do is just say, if you're a carpenter, these are the tests we do on you. If you're a policeman, these are the tests we do on you. We could do that. Or we could say, no matter who you are, we're going to do these 5 tests because they relate to the 5 functional things of the lower extremity that are needed to perform the activities of all of these people. Right, so we can go either way.
I think like if you have a pre-existing injury or sustain an injury that keeps you out for 30 days or longer, you have to, 1, have a score of 75% or better on your patient, or a particular score benchmark on a patient-rated outcome measure, pass a functional test, and pass a functional progression specific to your population, and then reference said appendix.
Okay, yeah, I like that. That makes it simple.
Right? Because like with every injury, we're doing a screening tool, a patient-rated outcome, and a functional progression, right? Okay. So I think that's all we have to say, and then you just have to reference the other document for whatever population you're in.
So we're gonna make like a, are we gonna put these policies there? Because you're saying reference the document. So are we gonna create them as like for the policy, or do they become their own appendix?
Sorry, you cut out a little bit.
Oh, sorry. So are we gonna use the policies that are already made as like their own documents, and they get referenced by the the one that we're making policy and procedure, or are they going to be appendices in the policy and procedure?
I had an idea of the first, just because he wants us to kind of post all of them on the website, and it kind of seemed like they were supposed to be in different places. So I think like somewhere like maybe on the front page or early on, we give the overarching one, and then we reference the population specific ones where I can attach to, hopefully figure out a way to attach the document in the spot that's already like specifically dedicated to CrossFit. So I think that they get referenced in the original. Does that sound good to you?
Yeah, I like that. So,
I guess to start, do you guys want to each take your own P&P and then I guess get rid of the overlapping components?
I think we would need to create our overlapping components first then.
Okay.
So I think step 1 is creating our overarching policies for this week, and then I think we can all go back and modify our original documents.
Okay. I sent out a Google Doc, I think, just so we can get started on that eventually. So we'll put the, we'll put those in there.
oh, I guess we need to develop our policy. Want to word that.
I mean, I think we can use some verbiage from a couple of the policies that we've already made. I mean, if we take pieces from, I mean, the firefighter one, it has an overall statement. Jamie's, yours sounded good too. Completely reword it. I think we just need to make it more inclusive.
Agreed. Where are we starting on this, Brett? At the bottom or the top?
Oh, it doesn't matter. I just put a blank document so we have it.
Okay. This is so cool. I can do all this on my phone. Technology is awesome.
I can do the definitions in the first portion.
Can everybody see me typing? Am I in the right one?
Yeah.
Okay, cool. Good. Ooh. Also doing this on my phone. I don't know how often it updates.
I think right now I'm looking at like there's 6 procedures that we wanted to include in our overarching. So if we want to just throw those into the document, and then people can just claim them as we go.
Okay.
Where did you send that invite, Britt? I'm not getting it in any of my mailbox.
I got it in my Gmail.
I can send it again to you.
I could just be lost.
Okay. Let me see. Jane Nicander 21.
Yeah. Hold on. My computer is being slow, and apparently I'm not getting it. So do you just want to write these down right now, and then we can delegate?
Yeah.
So I have definitions, which Emma already took.
Mm-hmm.
We need an actual policy.
Mm-hmm.
We need to include the ADA policy.
Okay.
Or discrimination policy. We need insurance procedures.
Mm-hmm.
Final clearance, like who's going to do it, so we can do another like hierarchy thing, like I think the firefighters had, which I liked. And then we had an actual like clearance procedure where we do the prom, we do the screening, we do the functional progression, overarching. So like a clearance procedures.
So the musculoskeletal tasks.
Yeah, but it'll include everything. So that's the one that says we do a prom, we do a screening, we do a functional progression.
Okay.
And then I think the only other one we talked about was a potential like acclimatization period.
Yeah.
Procedure.
Right.
I can do we're going to do a prom, screening, and some progressions, as well as the definitions.
All right.
Now, is the prom screening and functional, is that for the PPE portion, or is that for our 1 month out individual?
It's for the prom and the screen is for the PPE, and then we just separate it. And then the functional progression is the injury, and then the acclimatization is still part of that.
Okay. So we are going or not going to use proms with returning the month-long person as well?
I don't know about you guys, but we honestly approached those two clearance like procedures the same way. Like we didn't treat those patients any differently. So I guess maybe that's why I thought it could be overarching for PPE and a 30-day musculoskeletal injury. Simply because for both of those people, I'm going to use proms. For both of those people, I'm going to use a functional screening test like a triple hop. And for both of those people, they're going to do a several-day functional progression. So we actually approach those people the same way in our policies and procedures. I don't know how you guys differed those things.
We just split them up into two separate sections since, you know, the person who gets not cleared, gets injured, has to get cleared and then returned, and then the other person, you're just returning them. So technically two different situations, one of which isn't month long or could be longer than a month, because you could have someone who comes in with a broken leg and you have to wait. But, you know, who knows?
Yeah, I guess I'm still not understanding how in an overarching policy you would approach those things differently.
You would approach them differently, but they would, I just see them going in different sections based on how they're grouped. So it's like this individual was not cleared because of whatever reason based on definition of injury, right? So this was the reason why they aren't participating, and then we do the same stuff. Then the other person, this is the reason why they aren't participating, and then we do the same stuff. So it's like the reasoning is different. So it's not like different policies. It's just a different procedure for a different situation.
Okay, yeah, that's fine. In our overarching, we can have two different procedures. I see what you're saying.
Yeah.
Right.
I can do that part if you want. I don't know if you want to do the ADA thing, Nico, since you were interested in that, and then
I'm
I
on
can
it.
actually. Okay, I thought so. And then I can look at the private like gym memberships if you want me to. Simply because I know I have my agreement with Planet Fitness, so I'm wondering if I can just kind of look in there. And then what do we have left?
We have final clearance, and then functional progression / acclimatization. Hold on, let me change the order.
Okay.
So for functional progression, I mean, we're not going to have, I mean, a full rehab plan, obviously, but I guess should we just state with that there'll be an acclimatization period if there's an injury that's not disqualifying, but we'll get them into rehabilitation and try to give them rehab for their injury before they actually try to start the job. Where's Nikolai?
Yeah, it won't let me move it. Oh, there we go. Cool.
Okay, got it.
Yeah, I think you can do both because I think, I mean, I guess I can see how the acclimatization or functional progression period would be different for someone who had something in a PPE and someone who just had an injury. But I think that my idea about that is that if someone comes to a workplace with a limitation that we currently can't clear you for all work activities, that we're not just going to be like, okay, you have to wait for final clearance before we start anything. That yes, I would say that you're provided rehabilitative services if you're currently limited from work duties or participation, I guess. And then for someone who has a musculoskeletal injury or someone who's coming off of restriction, I think that you have, like, I mean, obviously we all do functional progressions, right? Where today we're going to try running at 50%, tomorrow we're going to try running at 75%. So for my group, we actually did a 4-day progression for each joint. But I think that you simply say that each population is going to have a period of functional progression so that they're not going from 0 to 100% participation in either case.
All right.
Did I kind of present what you just said now with both cases? I was kind of listening to what you were saying, and I was like, oh, we should make 2 of those. So they're going to be the same thing almost anyway. So it's not like we're redoing. It's like you said before, Jamie, we're not going to change what we did. We're just defining what we're doing with each group.
All right.
So there might be a little bit of wording difference, but we're going to treat both patients the same in terms of their progression. But we are basically just defining the groups of, if they are this, then we do this. If they are this, then we do this. So it's more procedural, I guess. I don't know a better word for that.
All right.
Okay, so who wants to do insurance?
I can kind of look at that since I did workers' comp for my group last time.
And it's ADA too.
Okay, and then I can pick up, I think Emma was going to do proms and screening again as well. So I can pick up I can pick up one of the functional progressions. I guess those are hard to separate.
Yeah, that's what I'm trying to understand this right now.
I'll do the functional progressions, and then Brittany, if you want to do the purpose policy statement and the final clearance. How does that sound?
That works. I'll change it on here.
So with the insurance, I'll come back so you guys can see me. I know I've been away for a little while. There we go. With the insurance, what am I looking for? What do we want? Is it just like, this is our policy with insurance and this is what we accept and don't accept, and who you are, it's fine? Or is it like, this is your insurance, trying to relate it to workers' comp because CrossFit doesn't have workers' comp? Is that kind of what we're, I know you had a thought process, Jamie.
Yeah, I mean, I just think that you say that since we are an external medical company with a contractual agreement with all of these or other organizations that their policies or their provided, like, you pretty much have to be covered by private insurance, because I mean, even, or separate insurance from us, like we do not pay, you're required to pay for your own services, but we will, like, we can bill workers' comp and things like that. But I think the purpose of this policy procedure would simply be to say you have to be covered by medical insurance. Otherwise, the cost of our services would be out of your own pocket. So whether that be workers' comp or like a private insurance, like it would be for CrossFit. And then I think you referenced the individual documents for that.
Okay. Now, quick, I just need a recap. So the 30-day is they don't have a disqualifying injury, but they have some sort of ailment that could potentially get worse. So that is that what that basically is? It's not a disqualifying.
They got hurt on the job. They
Okay.
got hurt on the job and they've been out for 30 days and we're trying to bring them back.
All right.
What are the qualifications that they need to have in order to work?
All right.
The other person got hurt, wants a job.
Mm-hmm.
We need to clear them for activity. We don't clear them. Why?
Okay.
So those are the two different groups. We have one person who already has a job who gets hurt and is out for 30 days.
Mm-hmm.
And that's where all the workers' comp concept
All right.
came
That makes
in.
sense. All right. All right. All right.
Yeah. So one person is getting a job, one person has it, one person got hurt for a while, the other person's already hurt but wants to work.
Okay. All right. And then after we do this, we have to have another video discussion on what our final product is.
It's more like a commercial again. He made it sound like it wasn't a commercial because we already did that, but we're making another commercial.
No, we're not.
So it's basically like, come to us and receive our services because this is what we do, which is what we already did. But
You just did that. It's the same thing, isn't it?
yeah. But it's basically like, this is why you should come to us because we have a policy now. So yeah, I don't know. I don't really know the difference between what we did. I think there isn't a time limit on this one. I don't know. Maybe there is. I didn't really peruse that part of the assignment very much. But we have to make a video that outlines, like,
Let me look at this. Hold on.
yeah.
Maybe we could, rather than shooting like a commercial, maybe we could just do like a screencast of our website and just kind of go through our website and click through and show some of the screenings or something and ask them or try to convince them that even though they're injured, they can come to our services. I mean,
Yeah,
I don't see how all of us can be on the video or if that's even necessary.
All right.
Yeah, I don't know.
Yeah, 3 to 5 minute video explaining. So create a 3 to 5 minute video explaining the organizational policy and procedure that we created, and invite patients or people to participate that sign up for any screening required with the procedure. So explain the policy and procedure, why it's necessary, and welcome them to participate in an inclusive and non-threatening manner. Create it in whatever format you like, embedded in the website. All right.
Okay.
Okay, so do we want to set maybe a deadline for this first part of it, and then we can discuss who's going to work on the website and who's going to work on the video later? Do you guys want to do that now?
We can talk about it now.
Yeah. Today's Tuesday, Wednesday, Thursday or Friday?
Friday morning? It gives us 2 full days.
Yeah, Friday's fine.
Yeah, that's good. That's fine.
So Friday for this first part, and then I mean, I'm willing to work with the website again since I already was, unless somebody else wants to do it. I wasn't a part of the video last time, so I don't care either way.
I'll be part of the video again. I think since you're more familiar with the website, Jamie, you could probably do that if that's all right with you.
Mm-hmm.
I like Emma's idea with the screencast, so we can screencast our policy once we have it written up, and basically talk through it, and then show some of the pictures of the screening tools and say, you can come get these, and then just be done with it. So
all right. Yeah, that works. That works. It's not a commercial, so it's fine.
Right. It's basically just the lazy, I don't want to read your policy, tell me about it.
Yeah.
Yep.
No.
I also do think it would be effective, like if you wanted to show a video of, like, for carpenters, I think there was like a lifting one. Like if you actually wanted to show like you taking somebody through that and explaining why that's important for carpenters to be able to do, or something like that, to like show our decision making as to why these things are important, these policies are important, could be effective as well.
Okay. So if we do that, I'm trying to think, we got 5 minutes. We would have to pick one for each group, and it would last about 30 seconds, which is about 2 minutes. And then there's 3 minutes explaining the policy procedure, which could work. Like I could help with the filming part and throw it into the screencast at the end, I guess. So it would be more like we do the screencast and then we splice it, put the videos in between with some explanations and talking. It could work. I could see what you're talking about, Jamie. Does that make sense, everybody? What I just said?
And I also think you don't necessarily have to do every group if you don't want to. I think you're just showing what our policies are intended to do for each population. So if you don't have time, I don't think you necessarily need to do one for every single population.
Just show what it is, what a screening tool is, and why it's important. I get you.
Yeah.
Okay. So yeah, if we did one and said, for example, this is this with this group, you can see the others on the policy if you read it. Yeah, that makes sense. I could see that. Okay, cool. Let me throw that at the bottom of this thing.
Yeah, and I just think the important thing with that video is just to make sure that we're being welcoming to already injured or all types of fitness levels or whatever it might be, that we have something to offer everybody.
Or do you guys have anything else?
Other than I'm doing this on my phone and it's fascinating me, no.